Hello. As a practicing dentist and your CDA president, my responsibilities now are nowhere near what I envisioned them to be way back when I was in dental school. With a rapidly changing and complex profession, we must shape a secure future for ourselves, our patients, and our association. My role as a CDA leader is to facilitate discussion, ensure that we are hearing from you and other members, and to cultivate solutions to the issues we all face as dentists. During the pandemic, CDA rose to the daily challenges and supported members in entirely new ways. Development of back-to-practice resources and toolkits and the nearly daily updates from CDA helped us all practice with confidence in highly uncertain times. With the pandemic behind us, CDA is now focused on the next challenge, improving value for you, our members, in a fiscally sustainable way. We're looking to shape our organization in ways that are most responsive to what it is that you've told us and what you want from CDA. We hear you, and we want to do something about it in meaningful ways. We have conducted extensive member surveys about CDA, ADA, and local society benefits that you're using and that you value the most. Additionally, a dedicated work group was established to evaluate trends in the profession, trends amongst our membership, and trends in the patient populations that we all serve. Today, I want to share a little bit about the initiatives that are being proposed to address these findings in new and innovative ways. The CDA Board of Directors has proposed a new membership model that will be considered by the CDA House of Delegates in November. While our current model bundles membership at the local, state, and national levels, the proposed model introduces member choice. Specifically, we are proposing that each member of CDA and their local dental society be allowed to choose whether they also want to be a member of ADA. ADA membership would no longer be mandatory for California dentists. We are considering this change because multiple rounds of member research and focus groups conducted by an external research firm have indicated that members derive significantly more value from CDA and their local societies, and if given the choice, more than 2/3 of our members in the surveys would opt out of ADA membership. We see an opportunity to be responsive to the voice of our members by introducing this level of choice into the membership model. Of course, we would still encourage ADA membership, and I know all continue to belong, but we just no longer believe it's appropriate to mandate ADA membership as a requirement for CDA and local dental society membership. For constructive change to occur, we must be open and curious. There are a few points I want to make clear about in this proposal and the process that we're undertaking. First, the concept is about an optional ADA membership model. Even if just 1/3 of CDA member dentists chose to retain ADA membership in this new model, California would still be one of the largest state memberships in the nation. The intent is for CDA to remain active and engaged with and still maintain representation at the ADA. We are in no way proposing disaffiliation of the CDA and our local dental societies from the ADA. Second, it's important to note that many of the factors that would make this proposal successful are unique to California. The CDA and its local dental societies have more than 27,000 members. This allows us to offer robust member benefits, resources, and other expertise and specific areas of professional support needed to practice in California. Members of other state dental associations rely more heavily on the ADA for resources and benefits than do our CDA members. Third, this proposal is a starting recommendation that has the support of the full CDA Board of Directors. However, it's still early in the process and nothing is yet final. We will continue the dialogue with ADA and their leadership across California, and we will likely administer another membership survey to refine the proposals and to bring forward the best solution for decision by the CDA House of Delegates in November. To some, this proposal may feel disruptive to our historic views on the membership structure. I am a fan of history, and we certainly heed its lessons, but I do reserve nostalgia for cars and rock and roll. Doing nothing, or staying where we are, is not a way to deal with the changing profession or to keep up with the wants and needs of our current and future members. We are all blessed to be members of an organization that is not content to rest on its laurels. We are called on to make difficult choices, take risks, and pioneer new ground. We are listening and proposing a bold move forward. The details I've shared today do just that. They signify a commitment to the voices of our members. This membership model proposal is one aspect of the type of change that we must be willing to explore. We are in discussions with ADA leaders about this proposal and hope that they will agree to collaborate with us in addressing our members' expressed wishes. As we build the future of our association, continuous evaluation of the services we offer to members will also be critical. Over the course of next year, we will be introducing an exciting new mix of event, education, and CE offerings based on what you've told us you want. We will also modify our dues structure to invest in early career dentists, making membership financially accessible for them while they are just getting started. Dues for the Life Active membership category will become aligned with active membership dues. Lastly, our House of Delegates will need to make decisions about our standard dues rates to ensure our future sustainability. We will continue to fight for the things that mean the most to you, like your challenges with dental benefits. We absolutely need to continue to address the often illusory dental insurance plans that exist today to secure meaningful coverage for our patients. This kind of reform, along with our litigation against Delta Dental, are where we are focusing CDA resources and attention. This work is complemented by programs that address the significant staff shortages hindering our practices, programs to support early career dentists who are entering the profession burdened with significant amount of debt, and continuing education and support for the various practice modalities and career paths in the profession today. I envision a future for CDA that is bold, diverse, inclusive, and never loses sight of why we exist: to help all members grow and become productive, successful, ethical professionals. Supporting all of you will take a strong CDA with the proper resources to assure a prosperous future. For updates on these and other important initiatives, please stay tuned for more CDA member communications and be on the lookout for future surveys to ensure that your voice is heard. Thank you for your continued membership and your commitment to the profession.